Ashley, come over here. All right, good afternoon, everyone. On behalf of the members of the Orleans Parish School Board and NOLA Public Schools, I want to go ahead and kick off our press conference for Thursday, August 27, 2020. I am joined here today with our board president, President Ethan Ashley, from the New Orleans Health Department, Dr. Jennifer Avagno, our medical advisor, Dr. Benjamin Springate, and my chief operations officer, Tiffany Dalcour. Before we begin the press conference today, I want our Louisiana families from the West to know that our thoughts and our prayers are with you during this very, very difficult time. And we are ready to provide support wherever we can. You know, this is really a challenging time for us here in the city of New Orleans, but it's also a time for us to repay the extreme kindness that we received 15 years ago. 15 years ago, Hurricane Katrina devastated our community. It tore our communities apart and forced us to reimagine how we will rebuild the city. After Katrina, our community rose to the challenge to build a more resilient future for the city and all of us who live here. And this year, once again, our city has faced another incredible and unexpected challenge as COVID-19 has turned our community upside down. It pulled our children out of school. It transformed our classrooms, and the moaning bell that we all knew so well, it now became a tone on a computer screen. And in spite of all of our challenges, we have once again risen to meet the moment in a true New Orleans spirit. And as a district, we have and will continue to work in this new reality. We're going to ensure that while classrooms may look a bit different, they will remain open, engaging, and productive spaces that allows our students access to the education and tools they need to grow and to succeed. And as a city, we have put in place the hard work so that we all can stay safe. We are pleased to report that the data reflects this. For 2 weeks, and I will say 2 weeks and counting, we have met all the health targets we have outlined in July. Daily new cases have fallen below 50 and are continuing to decrease. The positive test rate has also been at or below 5%. And the testing capacity continues to increase across the city. Thanks to the hard work of our residents, and based on this data, we are pleased to announce today that it's time to begin planning for a measured return to in-person learning. Assuming that the data remains the same, we will begin our measured approach to in-person learning, starting with our youngest learners in pre-K through 4th grade, and allowing schools to begin reopening from September 14th through September 25th. We know that schools are dynamic places to help the whole child grow. And as we laid out in our roadmap to reopening, we know that our youngest students have the most to gain from in-person learning, which is why we focus on getting them back into the classroom first and foremost. For our little ones, classrooms provide more than just reading and doing math. They allow for social and emotional growth. This is paramount and a challenge to translate through distance learning. But I must say this, we're very thankful for all of our teachers who continue to rise to the occasion over and over and over again, even in the midst of distance learning, to make sure that our students receive the services and the education that we know that they deserve, even though it has truly been a challenge. Our older students in middle school and high school, they have proven to be resilient. And once our youngest students have settled in, we will be excited to welcome them back to their schools, hopefully by mid-October. And as a reminder, any family member may continue to stay at home and learn through distance learning if they so choose to do so. As we maintain all along, health and the safety are our top priority, which is why we are taking a very deliberate and measured approach to returning to in-person learning. So in summary, distance learning will remain for all students until September 14th. At that point, each of our schools will determine the return date for pre-K through 4th grade within a 2-week window, which ranges from September 14th through September 25th. As we look ahead to getting students back into the classroom this fall, we have a robust and adaptable plan. While our schools might each approach their reopening timing and plans in the manner that is best suited for their school community, the guiding force and foundation for each of those plans is the roadmap to reopening, which we released this past summer. Our roadmap to reopening provides a path for keeping our school community safe and keeping our community protected. And if at any point a staff member, a child, a visitor shows signs of illness, we have developed strong guidance for all of our schools to follow to continue to ensure the overall health and safety of our entire community. And I'll again remind everyone that should the latest data requires it, as superintendent of NOLA Public Schools, I have the authority to close any school building and revert back to remote learning whenever necessary to safeguard our students, teachers, and staff members and their families. So in the coming weeks, as we prepare to return to in-person learning, we must maintain the same level of dedication and commitment towards the safety that we have exhibited to get us to this point here today. We must continue to mask up, wash our hands, stay home when we feel sick, and remain socially distant. If we stay on that path, we'll see all of our young people back in school. Let me say it again. If we stay on that path, we will see all of our young people back in school. We will be proving that yet again that we are a resilient and resourceful community, and together I know that we can do this. And before moving on, I would like to speak to you as a parent and as a former teacher. To our parents and to our teachers, I know these past few weeks has been challenging for each of you in ways we could have never anticipated. And I know you may be concerned about what comes next based on the announcement that I've made this afternoon. And while I cannot tell you the next steps will come easily, what I can tell you this afternoon is that here at the district and across all of our schools and across our entire city, we are here to support each and every one of you as we take the next steps together. Now I'd like to welcome Dr. Avegno from New Orleans Health Department to share more details on the state of health data here in our city. I gotta find my mask. Dr. Avegno.
Thank you very much, Dr. Lewis, Mr. Ashley, to the entire NOLA Public School leadership for having us here today. In July, we stood here in support of NOLA Public Schools leadership and our schools as they collectively made the decision to begin schools under a distance learning model. At that time, as you remember, the data did not support a decision to safely reopen schools and allow students back into classroom. We've talked about this a lot. There are many ways that we at the city and state level track the outbreak through data and use it to inform advice and decision making. One of those metrics is to look at the number of positive cases per day, and a threshold of fewer than 50 positive cases per day for our community was set several months ago, as we determined that would be one marker of showing us whether the outbreak was well suppressed in New Orleans. Today's decision to embark upon the school's reopening plan in a phased manner comes after considerable consideration of hospitalization data, testing capacity, positivity rates and percentages, and as Dr. Lewis said, a sustained decrease of at least 14 days below this 50 case threshold, as well as several other metrics that are always available on our ready.nola.gov dashboard. Since mid-July, when we stood here last, our current situation has significantly improved, as not only have our cases moved in the right direction, but again, as our positivity rates remain below 5% for a considerable number of days, and our testing does remain robust, with plans to support additional resources for the school community testing in coming weeks. While we acknowledge the uncertainty of the situation, given the city's current status, we do feel that the public health benefits to our younger learners support NOLA Public Schools' plan to reopen classrooms in mid-September using, as Dr. Lewis said, a very deliberate, slow, and phased approach. That's because of our community. Our residents, our citizens have really stepped up to reduce the rate of spread since mid-July, and that is the reason we have shown this improvement. But there is still a lot of hard work to be done, and this progress must be sustained for the long term. We cannot go back. We cannot change our behaviors now. We must remain vigilant to stay safe and keep our kids safe. We cannot forget the guidelines that have gotten us here this far. Please practice social distancing everywhere, whether you are at school, whether you are at home, wherever you are. Avoid large groups everywhere that you go, and especially if you are out in the community. Wash your hands, wear your mask and face covering always, and if you are sick, please stay home and contact your healthcare provider. Our children's success and health continues to depend on our actions individually and a city. Thank you.
Thank you, Dr. Avegno. Always your information is very, very insightful to all of us. Now I'd like to welcome Dr. Springate, who will provide an update on testing this afternoon. Dr. Springate.
Thank you, Dr. Lewis, Mr. Ashley, and members of the Orleans Parish School Board leadership for the opportunity to be here today. On behalf of LSU Health, my colleague Dr. Ryan Pasternak of LSU Pediatrics and I continue to be very glad to work with NOLA Public Schools as health advisors. Today I'm pleased to share news of valuable support for NOLA Public School teachers and students as classrooms reopen to in-person instruction, specifically COVID-19 testing. While the city has expanded its testing capacity citywide, thanks to the leadership of Dr. Avegno and others, the district has also been working collaboratively with schools, with Dr. Avegno, and with local leaders from our major health systems over many weeks. to identify additional testing capacity that could be brought to bear to support NOLA Public Schools and school reopening in particular. We believe that developing a broad and varied strategy to testing, especially given what a challenge it presents to communities across the country, will help support our educators and students and larger community as we take this next step in reopening our classrooms. This September, as our youngest learners and their teachers return to in-person learning, NOLA Public Schools is dedicated to helping increase the ease, accessibility, and frequency of testing for both NOLA Public Schools students and staff. Therefore, working in partnership with LCMC's Children's Hospital in New Orleans and Ochsner Health, NOLA Public Schools will be able to provide timely, responsive testing for our school community. Additionally, NOLA Public Schools is working with Tulane University to develop a strategy for routine testing for teachers and school-based staff. Our school-based staff and students will be given frontline service to timely COVID-19 testing if they are experiencing symptoms. Tests will be available through a mix of urgent care facilities, hospitals, and mobile units deployed to community locations on a daily basis to provide convenient, family-friendly access to rapid COVID-19 testing for staff and students. More details on how to access these testing services will be shared in the coming weeks. In addition to these strategies, NOLA Public Schools will continue to explore testing opportunities for schools and students through additional local partnerships and as new technology arises to help better detect and respond to COVID-19 cases in our school communities. As we prepare to return our students to the classrooms, timely and accessible testing represents an important additional step to ensure that everyone stays safe so our schools can continue to reopen in this phased approach. By continuing to take the necessary precautions across the New Orleans community, such as practicing social distancing, washing hands, and wearing masks or face coverings, we can all protect each other and help expedite the return of our students and teachers to school and their daily routines. Thank you.
Thank you, Dr. Springate. As you can see this afternoon, as we continue to have this major health challenge here in our country, but also as we think of the city of New Orleans, to have our major health institutions to continue to step up and find ways to support our NOLA PS family is remarkable, and we're very, very thankful for that in the news that has been shared here today. Next, I want to welcome our board president, Mr. Ethan Ashley, to come and just share a few final words at this time. President Ashley.
Thank you, Dr. Lewis, Dr. Begno, Dr. Springate. Thank you for being here. I'd like to start by just thanking the community. Our students, our families, our teachers, our staff have all helped to get us to the point that we are at currently. And I'd like to send a special thank you and shout out to our parents, our grandparents, our caretakers, as well as our teachers who have worked collaboratively during this time of virtual learning. As we knew it would be, this school year is proving to be unlike any other before it. One thing that has remained the same, though, is the spirit of our New Orleanian just coming together to be able to help us drive out and down the causes and cases that we're currently dealing with around the coronavirus. And that's because a lot of us have done what we've been asked to do, and that's mask up, stay safe, and inside. That has ultimately given us the opportunity to stand here before you today to basically say we have the chance to allow our students to return back to school. And while we've been right there beside you this whole time, today we're pleased to announce that based on the latest health trends, our youngest learners, which is oftentimes considered some of our most vulnerable learners, will be able to return back to school, as Dr. Lewis has stated, between September 15th and the 25th. Now, I think Dr. Lewis said it also. It's an option. And, for those families who are still wanting to allow their young people to stay at home, you can do that. And so I just want to make sure we're clear about that. Now, I also want to thank our friends at LCMC, Ochsner, and Tulane for their partnership. Three of the largest institutions, health institutions in our state have come together to partner, and that's because we've all recognized that we need to work together on behalf of our students, families, and teachers to help us get through this challenging time. In the coming weeks, we'll be working alongside our school leaders and our teachers as they prepare their classrooms for in-person learning. And while we're supporting both our parents and families to make sure that they get the guidance that they need to return to school, I just want to make sure that you all know that the Orleans Parish School Board and the district is ready to stand with you as you return back to school in an in-person fashion. For our parents, we urge you that you stay in close contact with your schools as they'll be providing you just necessary details on the next steps for your students. And I can't stress this enough. Please continue to mask up, wash your hands, and stay home if you're feeling unwell. We've all done our part again to slow the spread of the virus, and we need to keep it up. Together, we can ensure that all of our students are able to get the best education possible, and we know that in-person instruction is definitely one of those ways that we make sure that our students are able to get the best education possible. As the superintendent has started this press conference, I think we'll end the press conference by basically saying our thoughts and prayers are with all of those families who were impacted by the hurricane. Please know that this district will continue to be open and will be able to provide all the resources that we have available to be able to help those families in need as we remember how a lot of our neighboring both cities, parishes, and state did for us 15 years ago. With that said, I would like to turn it back over to Dr. Lewis. Thank you so much.
Thank you again, President Ashley, for those words and also for the reminder for all of those evacuees who are here in our city. And as we again remember where we've been 15 years ago, as he stated, we're here ready, able, and prepared to support all of those families that are in need of our support. At this time, I'll turn it over to Dominique. We'll go ahead with our questions.
Good afternoon, Sherman with Channel 6. This is actually a viewer-submitted question. They want to know how many student, teacher, and family illnesses are considered acceptable before it's considered as heavily impacting the school system.
Yes. At the back now? Okay. Yes. So Tiffany Dalco will come as our Chief Operations Officer, and we'll go ahead and share some information about that.
Thank you for that question. It's a question we've received in a couple of our past press conferences as well. Our roadmap to reopening does provide information about what metrics we'll be looking at for the closure of an individual school, as well as the closure of our entire system once we reopen. So for an individual school closure, no school will close without consultation with us, our medical advisors, as well as the City of New Orleans Health Department. If there are multiple cases within a single school, that could be cause to close that individual school. If there are many closures that are needed of our school system throughout the city, that could be a reason to close the system. We will always rely on the information from Dr. Abegno, though about how the city's health data may be changing over time, and if it's for the public health benefit to close our system as well, we would be ready to do so.
Natasha Robin with Fox 8 News. I know you said that all students would have a choice to remain learning virtually. When will that decision have to be made? And if they choose to continue virtual learning, will they be locked in to that decision for a certain period of time?
Yes, so based on this announcement today, our schools will be again reaching out to their individual families to continue to update them on this announcement today. And even though we collected information in the beginning of the school year, whether families were going to opt into in-person learning or distance learning, now that we are actually under distance learning, we're also reaffirming the wishes of our families. But again, if a family is choosing, as we have made this announcement today, to open pre-K through 4th grade beginning the middle of September, if a family decides to remain under distance learning, we made it very clear through our roadmap that those decisions are based on the 9 weeks. And so that family would need to remain in distance learning for the remainder of the 9 weeks. And if they're going to make a decision to change, they can do so at the conclusion of each 9 weeks.
My question is about when older students do return. So under the old guidelines in phase 2, they would be returning at least 2 days a week, the older students. Is this different? Would they be returning daily, or is it still that same plan?
So our plan is still the same. The difference is right now, as we think about reopening to in-person learning, compared to how we released the roadmap. Right now, beginning mid-September, we will start with our pre-K through 4th grade. And then as we get to the point of being able to bring our middle and high school back, the same guidance that we have in our roadmap is our plan as we move forward. However, let me say this. This has been a very fluid situation. As you can see, we had a plan of how we were going to start in August, and we had to pivot based on data. As we start with our youngest learners, and if we learn more and decisions have to be modified, we're going to do that because the health and the safety of our students and our educators will remain our top priority, even though we have a very solid plan that we're following.
I understand. May I follow up just for clarity?
Yes.
For my sake. So as of right now, if health trends continue, when students go back, the youngest students go back between September 14th and 25th, they will be allowed to go back 5 days a week.
That's correct.
Okay. As of right now.
Yes.
Thank you.
Yes, thank you all again for joining us for this very, very important announcement. We're very pleased at this point because our community has responded to the call that our mayor continued to put out about how it was so important for our numbers to go down and for all us to practice social distancing, wearing our masks, and all those things there, because what we're able to do is stand here today and make the announcement to say that our kids, and in this case, our babies, are going back to school. And we're so proud to be able to do that, and we're gonna have to continue to work as a community to make sure that our young people can remain in school and eventually have the opportunity to bring our middle school kids back and our high school kids back. But again, I will not let this moment pass us by, where I know tomorrow is 15 years past Hurricane Katrina. And again, we have our fellow members from the state of Louisiana in our city because they had to evacuate. And it's a reminder, as a school system that was torn apart in 2005. In 2015, we are standing here ready and prepared to support all of our families that have evacuated here to the city of New Orleans. If you're here for a short-term period, long-term period, we are here to support you and provide the needs that you need, especially when it comes down to our young people who have evacuated here, and we want to make sure that they continue to receive their education. So again, this concludes our press conference for today. I want to remind everyone to mask up, practice social distancing. If you're sick, please stay home. And together, I know that we can do this. Thank you, and have a great afternoon.